Yes, I did. When?
All right,
6th grade.
let's get started.
Yes, I was.
Here's recording, by the way.
Oh, you don't go back in. Yep. When you put in.
All right. We talked about the cardiac cath, I guess is the last thing we looked at was the video, the angiogram video. And so we talked about that, stent placement and all of that kind of stuff. So if stent placement doesn't work, okay, then they go on to the cabbage. That's one of your payday abbreviations this week for coronary artery bypass graft. Anytime you hear that word graft, that's just like taking something from one place and moving it to another. So y'all have heard of grafts, like skin grafts. Most people have to have skin grafts and not take healthy skin from one area and move it to another area that needs skin or So coronary artery bypass graft, what they do is because of those areas that are like clogged up, normally like we watch on the video, if they can stick that wire through it and put a stent in and open it up, then they'll do that. But if they get in there and it's completely blocked or the damage is so severe that they can't do that in that kind of surgery, in that cardiac cath, then they will do an open heart surgery. And that's what cabbage is. It's like your standard when people say, oh, they had to have open heart surgery. This is usually what that was. Not always, but this is usually it. And so what they do is they take a vessel out of your leg, usually like lower leg, and they actually graft it into the heart. And so what they do is they'll put one end of that vessel on the aorta, sew it in there, and then they bypass the clot, and they will attach the other end of it down below the clotted area or the blocked area.
How do they sew it in without all the blood getting caught?
Well, they hook you up to a heart-lung machine that actually, like they make it work. They actually really stop your heart to work on it. And they hook up your vessels to a machine that oxygenates and pumps blood for
If you're like afterwards when the blood is going through, how does it get caught?
Well, they would have to do major blood thinners, like big time, heavy duty blood thinners. So that helps it. But yeah, so this is an example. So you can see it's up here in the aorta, and then it's attached again down here. And then this one is attached here and here. And so that's why it's called a bypass. It bypasses the blockage. So if they have a double bypass, then they would have 2. Triple would be 3. Quadruple bypass, they would have 4 areas of grafting. Does that make sense? Mm-hmm. So it's just like makes a little bridge basically over the clot. Reroutes the blood. Do it.
Like,
they would probably remove the clot. This is more of like a clot itself. They probably should be able to remove. This is more like if their arteries were completely blocked, like 100% blocked, with fatty plaques on the inside. Or blocked to the point that they couldn't, make them better. So that's a cabbage. Here's a ventricular septal defect. Remember we talked about that's just an opening or kind of an opening or a hole between the ventricles. So it's kind of a weird picture, but you can see that in there. The aorta, we know, is the largest artery in the body. It arises from the left ventricle. We know that. Transports blood all over. Let's look at some arterial diseases. Arteriosclerosis. Sclerosis, we know, is hardening, and so specifically of the arteries. Results in loss of, so the hardening of those can be a result of long-term blood pressure, fatty plaques, things like that. So it makes it where it won't move, like constrict and dilate like it needs to, which causes blood pressure problems. It can increase blood pressure, right, if they can't do that. So if your blood vessels can't open like they need to, if your heart rate speeds up or if you start doing exercise, that's what should happen. But if you don't, then your blood pressure just gets higher and higher. Or it can cause an aneurysm if they're really weakened, and we'll talk about aneurysms in just a second. Atherosclerosis is fatty plaque, and where they get hardened and build up, kind of like we talked about on the inside of these arteries. So we've already talked about that quite a bit. Emboli down here says results in narrowed arteries causing hypertension, high blood pressure, and then emboli. An embolus is something that floats, actually like a foreign body that floats in the bloodstream. So it could be a clot, part of a clot breaks off and like a chunk of a clot is floating. Floats to the brain or to one of the blood vessels around the heart, or maybe it floats to the lungs. That's an embolus. So whenever it starts moving, and it doesn't have to be a clot. It could be maybe some of the fatty plaque broke off and is floating in the bloodstream. Could be air. If someone were to give you a whole bunch of air directly into your veins, like through an IV, it can cause an air embolus. So it's anything that's like foreign that's moving around in the bloodstream.
Could you die from that?
Yes. Not we're not talking about little bitty bubbles that are going in, but because those will most of the time will just get absorbed in your bloodstream. But yeah, if you had a lot of air go in, then yes. That's why they always prime the line. Like whenever somebody's getting an IV and it has like tubing, they always run the fluid all the way to the end of the tubing before they put it in. Because otherwise you got all that space of the tubing and it's got air in it, and that's what goes in. It's a closed circuit. So not circuit, but a closed system.
I think a while ago someone asked him did that.
It's been done. I'm sure it's been done. All right, an aneurysm is a ballooning out or kind of like a stretching out of an arterial wall. So it's usually caused by weakened arteries. Could be arteriosclerosis. It could also just be a congenital defect in their arteries. It could just be something they're born with. I had a home health patient one time, and he had 5 different aortic aneurysms. They just happened to catch the first one, and it hadn't ruptured, but his arteries are just weak, and so he's had multiple ones. Very, very dangerous. Signs and symptoms says sometimes you can have pain or pressure, but a lot of times people have 0 symptoms. They have no idea that they have this. I've always had a fear of having an aneurysm. Anyway, I don't know why. But, so yeah, young people sometimes will die of these. They'll just suddenly die, they go back and they've had an aneurysm. It's just something it was just something they were born with. Their arteries were just weaker. So it doesn't have to rupture to be an aneurysm. It can just have that balloon, but it can rupture. And if it ruptures in your brain, then usually it causes a stroke. It can cause death, obviously, too. If you get an aortic aneurysm, then usually people with aortic aneurysms don't make it. They don't always make it, or they always don't make it, but usually they don't, because normally they don't catch it until it ruptures. There's no reason, they're not going to do a scan on everyone for just an aneurysm, to see if it's ballooning out. They may not have any other symptoms. Because you think about your aorta, every bit of blood that goes to your body starts in the aorta. It carries a ton of blood. It's all of the blood that goes everywhere else. So if something happens to that, if it ruptures or opens or tears, then that's losing mass amounts of blood every time the heart beats. It just takes a few minutes. Usually found cerebral aneurysms are probably the most common aneurysm that you hear of. Like I said, cerebral aneurysms, they can cause death. They can also cause a stroke. Abdominal, aorta, and then even upper, the aortic trunk area. Only treatment is surgery. There's nothing else they can do. And it's just either have surgery. If it's still just ballooned out, it's like an emergency surgery. Like, we got to get this done. Here's a normal aorta. What they just cut it lengthwise and then pinned it down so you can see the inside of it. See how smooth it is? And then here's some disease ones.
They've been dried or something.
Do what?
It was very dry.
Yes, but notice too, got all this plaque buildup, right? Really rough looking. It would be very easy to get a clot in there. So, severe arteriosclerosis, again, you can just see all of the damage to it, the edges of it. All right, MI, or heart attack. So this is where those coronary arteries, the ones that are specifically supply the muscle, the heart muscle with oxygen, get cut off. Blood clot. Maybe it's an embolus. Maybe it's just 100% blocked, right, with fatty plaques. So an infarct is the death of tissue because of decreased blood flow. Ultimately, oxygen is why that happens. And you'll hear that word other than just the heart, infarction. Sometimes you'll hear it, you might hear it even talking about the brain or something, but this is where you hear it most. Signs and symptoms are chest pain, or a lot of times people might complain about pressure. Like they may not say that their chest hurts. They may say, feel like an elephant sitting on my chest, or something along those lines. They just feel like an intense pressure. Sometimes it's just heartburn. I had a friend who, I probably told you the story already. Husband was like 35 and kept thinking he was having heartburn all day long. Heartburn. Took like a whole thing of Rolaids and was like, it's just not getting any better. So his wife took him to the hospital after work and he had a massive heart attack. And he was 35, and relatively healthy, wasn't. So that was that his symptoms were not, necessarily as bad as you would normally think of heart attack symptoms. It's not just somebody's going to say their chest is hurting. That is part of it, but that's not all. Sometimes they vomit. Sometimes that pain goes up into their neck or their jaw, especially, or down their arm. Women, especially, their pain tends to radiate to their back. So a lot of times women's heart attacks go undiagnosed because the symptoms are just a lot different. It's not like your standard chest pain symptom. It may kind of hurt in the back, or they may just be nauseated. So it's hard to know sometimes. Sweating. So they might just be sitting there comfortable and you're like, why are they sweating? They have like lip is sweating or their forehead's sweating and there's no reason for them to be sweating.
You're enforcing my irrational fear of all this stuff.
Yeah, I'm just like, I sweat sometimes.
I'm sweating now.
I sweat.
But I'm just talking about I'm not talking about people just being like, some people are just sweaty. But I'm talking about just sitting there comfortable. Maybe their stomach hurts or whatever they're complaining of, but they're not moving or doing anything. It's not necessarily hot, but they're like clammy skin. They're just sweating. They're like, what's going on? I mean, this is a different look. You would know there's something weird going on.
How would you tell if they're like an athlete, they're not like running or something?
Well, I mean, they're probably gonna have some other symptom. That's not gonna be necessarily the only symptom. They might be having trouble breathing, like they can't catch their breath. They're really nauseated. Chest feels tight. There's probably gonna be multiple symptoms. Not always, but and then shortness of breath, of course. Treatment, they can get to it early enough. Sometimes they can just be treated with medications, like they'll give them clot busters or might give them something to really dilate. Usually that's the first thing they're going to give them something that will dilate their blood vessels. So what that does is that opens them up and hopefully blood can get around the clot or around the plaque, whatever it is. That's that.
What would
If
they do
not,
when they could do that?
do what?
Like, how do they do that?
It's just a medicine that makes your blood vessels dilate. Nitroglycerin is one example. That's it. Just a massive vasodilator. And then with those
You overdose on stuff?
Do what?
You overdose on it?
I'm sure. That would lower your blood pressure to the point that you don't function. Nitroglycerin causes a super big drop in blood pressure, so you have to be careful about with it. Medications, oxygen, because what blood they do have flowing, you want it to have the maximum amount of oxygen it can have. And then anticoagulants, which is the medical name for blood thinners. The medications that really thin the blood or make it really slippery so that it can pass on through.
What do you call blood thickeners?
What medicines? Well, you can give vitamin K. That helps.
Potassium?
Huh? Is that potassium? No, that's not the same. Vitamin K combats, like if you overdose on your anticoagulant, and I don't mean overdose like somebody's going to specifically take too many, but sometimes it's really, when people start taking anticoagulants, some of you guys may have had family member something on Coumadin or warfarin, and that medicine is so hard to manage because you have to do blood work all the time because it has to, your blood, like the thinness of your blood, if you will, like how easily it can move through your blood vessels, it's measured on a very small scale. And so it's you have this really little range. And if your blood gets too thin, then they have to give you they take away some of that medicine. I mean, it's like every week you go to the hospital or go to the doctor and they check your blood levels. And that's like a frequent thing. Sometimes they can, once it regulates, they can go a little bit longer, but vitamin K is always something. If we have patients who's, it's called a prothrombin time, they measure clotting times. And so if it was way high, then the doctor would say, we need to give them a shot of vitamin K, and then we'll recheck it tomorrow, and that'll thicken it back up. So, I don't know if thicken it back up, that's not really the medical way to say that, but anyway, so anticoagulants. Or, of course, surgery, like we looked at yesterday, like the cardiac cath that we looked at Tuesday in the video where they go in with the catheter and put in a stent and open it up. Or the other option, the last option, is the CABG, the coronary artery bypass graft. All right, congestive heart failure, or CHF. So this is not like heart failure we watched in the movie the other day, right? He probably had some congestive heart failure. He had true, like acute heart failure. This is congestive heart failure you can live with for a long time. It's a chronic disease. It's something that you battle, like you treat it, as best you can. And so what's basically happened with congestive heart failure is that your heart has just gotten tired. It's like it's just worn out. Maybe blood pressure's been really high or lots of fatty plaque buildup. And so your heart has had to work really hard to pump blood through those tiny little vessels or to pump blood against, arteries that are stationary that will open and close like they need to. And so the heart just wears out doing that. And it's just not strong enough. It just can't keep going. So it just pumps very ineffectually. It won't pump the way it needs to. So what do you foresee as some issues if your heart, okay, think about your heart and what all goes in and comes out of your heart. If your heart quits pumping effectually, like it's not pumping enough to really get the blood out and moving, what are some things that are going to happen? Low oxygen, because it's not making its way through as well. What else?
We're going to get limbs amputated because it'd be dead.
Yeah,
Well,
like
if they don't have any blood
circulation
flow,
problems.
then yes. Do what?
Like circulation problems.
Yes, definitely. Circulation problems.
What if their tissue dies? Some of the tissue dies.
If it doesn't get oxygen, it will eventually. What about, let's think of it like a traffic jam. Okay, so your heart's not beating like it needs to. It's not moving blood. Blood's moving out of it slower than what it should be. But you still got blood that's coming back to it. So this congestive heart failure, this is where that comes in. Yeah, it gets backed up. Right? So if you got right-sided heart failure, right-sided congestive heart failure, where's blood going to get backed up? On your lungs. What?
On the left side.
Well, if you've got right-sided heart failure, where's blood coming from when it gets to the right side of the heart? Your vena cava, it's coming from all over your body. So if you got right-sided heart failure, and sometimes people have both, often they do, but specifically right-sided heart failure, it's really going to get backed up in the body. Usually it ends up in the legs because there's gravity also that's working against you. So any of you guys have probably seen family members or something with, it's called edema. It's one of the symptoms listed up here. That's just swelling. But typically with congestive heart failure, people have what's called pitting edema. And that looks like, here's my pictures. Here we go. That looks kind of like this. Here's a better picture. So see how swollen this person's foot is? And look, they grabbed it with their hand, and look at this impression it leaves.
Oh.
See where their hand was here and down here? Same thing. This one has a fingerprint in it.
Why would you do that to someone's leg?
It's not like, I mean, you just mash on it and it will just go in.
Why would you touch it though?
Well, part of your assessment is to see how deep it pits. It has a system of measurement. So it goes 1+ to 4+. I would say this one's probably 3, and this one's probably 3 or a 4.
I would do that, but the other one,
edema.
I would just be like,
well, what happens is, okay, think about it. All that blood gets backed up in your legs, usually. Okay, and sometimes they'll carry it all over, kind of have fluid everywhere. But if it gets backed up in the legs, you've got all this blood in those blood vessels. And so what happens is, because there's so much pressure down there, because it's not moving, then you have fluid that leaks out of those blood vessels. And it's usually just clear, like lymphatic fluid. It's kind of like plasma. They just clear fluid. It's not blood doesn't leak out because those red blood cells are too big to squeeze out of the vessel. But water and electrolytes, that kind of stuff does, and it stays. So it's gotten pushed out. And if it gets bad enough, it like can seep through your skin. Like I've had patients that look like they had cellulitis like this, and it looked like it was just sweating or something. But it wasn't sweat. It's like lymphatic fluid, like watery kind of fluid. And that causes cellulitis. This is cellulitis. So they've got an infection now. Skin, this is turned into a skin infection because of the way that their leg is pulled. Their skin has gotten really tight. It's gotten really irritated. It gets very, very dry. And then you've got this kind of an infection going on at this point. And it's not getting good blood flow. It's not getting good oxygen, so it doesn't heal quickly. It's a whole mess of symptoms. So they need antibiotics as well as a diuretic. And a diuretic is a medication that makes you get rid of fluid. So Lasix is an example of that medication, and it makes you go to the bathroom a lot, so you can get rid of lots of fluid. Okay. So that's pitting edema.
So will the impression go away after a while?
Oh yeah, no, it'll come back. Yeah, it doesn't stay.
I was like, oh yeah.
Other symptoms are, let's talk about this for a second. So left-sided heart failure, left-sided congestive heart failure is going to back up into what? Pulmonary veins, which backs up into the lungs, right. So that causes a whole nother slew of problems. So a lot of times if people are really having a big time, a bad exacerbation of their CHF, they'll have all this edema. They probably have a lot of fluid in their lungs too. Same thing happens in the lungs. They get all this fluid. Well, what happens when fluid sits in the lungs? What do you think it grows?
Bacteria.
Bacteria, just like any fluid that sits, it doesn't get moved. And then they end up with pneumonia. That's what causes pneumonia. So a lot of times people with CHF, if they come up, if they've got a cough, really wet cough, it's like you can hear it gurgling, or rattling in their chest big time, okay, maybe they may have some serious fluid issues and they need something to get rid of fluid, and probably at that point some antibiotics too. So shortness of breath is another symptom, right? There's so much fluid in their lungs, they can't get air in there. because the fluid's taking up all the space. And breathing fast. Cyanosis. You might see a word in there, you know. We know osis, yes. Now what cyan is? Like the color. It's blue, right? So usually cyanosis is like blue around the lips, or their fingernails might be kind of blue. Not talking about bright blue, but just purpley blue. Looks like it's not getting good oxygen. That's cyanosis. Neck vein distension, why that? What is distended? Do you know that word? Distension. It's sticking out where it's full, right? So think about their neck veins. Why would they be distended? It means that you can see them. They may just be sitting there resting, but their veins are sticking out. You're like, well, they shouldn't be doing that, right? They're just sitting there doing nothing. Right, because it's congested, right? It's all backed up, so it's filling those up, and they're full. Weak pulse, because their heart's not beating like it needs to, and then a cough because of the fluid and difficulty breathing. Treatment, so one is meds to reduce fluid, meds to keep the kidneys in gear and get rid of extra fluid. Cardiac meds that help the heart actually contract better. And then last, or oxygen, because again, the blood that they do have circulating, you want it to have the maximum amount of oxygen it can. And then last is a low sodium diet. Why is that? Yes, has to do with blood pressure. Yes, so y'all remember learning about osmosis last year? Osmosis is the movement of water through a semi-permeable membrane. Well, water follows salt. So wherever you've got solutes, right, water is pulled along with it so that it can equalize. That's what happens when you eat a whole lot of salt. Makes your body hold water because your body is trying to like equalize the ratio basically of salt and water, so it's pulling it in. So when people have a high salt diet, they're holding water, which causes that edema. And if they're already not circulating like it needs to, it's just making them have to circulate more fluid that they don't need to be circulating. They can't even circulate what they need to.
Salt water does that too?
Yeah, you can't, that's why you can't drink it. Yeah, it would like severely dehydrate you and just, you know. I watched this one, we used to watch the two survivors, dual survival. So it's not as good as it used to be. Go and watch that show. Yeah, it was a really cool show. Yes, I know. One time he made drinking water out of salt water he had a tube. Yes, and so he burnt or like boiled the salt water. I don't know, it was crazy, but he had this tube and he just produced condensation is what he did, and it was pretty fun. Total side note. Myocardial infarction, here's a pretty good picture of one. So it says they had a thrombus in the coronary artery, which I don't really know how to find that, but anyway. But this is, you can see this is the area that was damaged.
Looks like a bad
So see how this was dark, really dark. And so it's definitely a bad one. Obviously, you can see that. But this is in their left ventricle. See how much larger this one is than this one. So left ventricle, and it just wiped out that whole area. And what has happened, the reason there's blood on the outside is that the pericardium has two layers. It has a parietal pericardium and a visceral pericardium. And those have fluid in between them. They're supposed to have just a little bit of fluid. And what that does is as the heart beats, it allows for some friction to occur because the heart is moving, within the body. So, but it looks like there's bled into that space between is what that looks like to me. That could have happened after. I don't know if that happened before or after the heart attack.
What's the name of the metal wall again?
Septum.
Septum. What happens if it's too long again?
If it's what?
Too thick?
I looked at something on that the other day. I don't know that we necessarily talked about that. It's too thick. There's an aneurysm, so ballooning. You can see that.
Don't get
Here's
that
a one
big.
that you can really tell a lot more about. So this is the abdominal aorta. These are the kidneys. So this one is almost as big as a whole kidney. Okay. Let's see, what else? This is a dissecting aneurysm. So what's happened is, anytime you hear that word dissection, basically it's the walls of the artery have separated and blood's gotten behind them. You have 3 layers. Your arteries have 3 different layers. And so they just separated, come apart, and then blood got stuck between them. Here's an aortic tear. So you can see these are those 3 blood vessels that come off the top of the aorta. And then here's a tear, an opening in it. And again, you just can't live very long if your aorta is leaking blood. I mean, there's people that make it, but it's unlikely. There's just so much blood that's being pumped that, you just lose it too fast.
What kind of stuff?
I mean, if you had damaged, if you had really severe arteriosclerosis, if you had some kind of injury, that could do it. If you just had if you just genetically had a weakened wall, then it could tear a little easier, something like that.
How do they fix it? They're like, how do they find it?
Well, if it's really slow leak, they might find it. You might figure out that you're losing blood or something else is going on. But if it's a larger one, then you don't know it until it happens, and then it's just doesn't last very long. So again, not I know somebody who lived not too long ago with an aortic. I think he had an aortic tear, and he made it, but they didn't think he was going to. Here is basically it's dissected again. So a dissection where it's those walls have separated and blood got behind it, and you just closed off that whole vessel. Infective endocarditis. Talked about endocardium is what again? Do you remember? Yes, the inner layer of the heart. It's like the lining on the inside. And that lining, where it meets, well, the valves are really part of the endocardium. They're like where it lines and just it's like a little strip of endocardium that has come out of that lining. And so endocarditis usually affects valves. That's what you'll see it. And so that's what this is. Let me see what they said. It says that demonstrates how the infection tends to spread from the valve surface. Vegetations can be seen on the endocardial surfaces, and the infection is extending into the myocardium. But anyway, it's some of this disease-looking area. But this one, endocarditis again, so it's completely destroyed. I'm assuming it's this is all the aortic valve right here. Opened it up, and it has really looks horrible. These are splinter hemorrhages. You get them in fingernails with infective endocarditis. So I kind of had a flip out moment last pregnancy because I had a bunch of these. I was like, oh my gosh, I have infective endocarditis because we had just gone over this. But no, you can get those with vasculitis too, and that's one thing I have a lot of vein problems in pregnancy, so that's why I was getting them. Okay, a prolapsed mitral valve. So notice on this valve, see how it's like ballooned upward right here? It should not be like that. It should be like a flat, kind of flatter valve. And prolapse just means that it's sagging or it's like moving backwards. It's kind of like it's hung back. So that's what they're showing you here is this prolapse. It's really easy to see this one. So a big blood clot here and this coronary artery. So it blocked blood flow, and all this area you can see died. See how much darker it is? So that's the really right here, you can see that area. Okay, normal coronary artery is cross section of it, so it's nice and open. And here's one that's got lots of fatty plaque, right? So all this in here.
Is that the camera that they can put in your veins?
Well, this is a microscopic picture, looks like to me, but it take a cross section, you know, and then just open it. So you can see why, if you've got a lot of atherosclerosis, it's going to be harder on your heart, right? It's trying to pump the same amount of blood through this hole as it was supposed to through this. It's going to put some extra pressure on your heart. All right, some blood disorders. Anemia is a decreased number of red blood cells, or it could be decreased hemoglobin, or maybe it's just not functional the way it needs to be. Signs and symptoms, paleness, especially one area to look for anemia is in mucous membrane. So pull down the eyelid and look in here in the conjunctiva. It'll be really pale. It'll be nice and pink like it should be. It'll be kind of pale and white. Fatigue. That's usually the first sign. Like for me, especially a lot of pregnant women have anemia. Part of that's just because you're carrying double the amount of blood, and there's a whole other person who's using up your oxygen, right? So that was one thing I noticed for me at the very beginning of this pregnancy. I was like so tired I couldn't even sit down. And I thought, okay, I think I probably need to take some iron. So that helped. And then increased heart rate. Why would your heart rate increase with anemia? Think about it. Right. So you don't have as much oxygen in your bloodstream, so your heart's trying to compensate for it. And so it's pumping faster, right? So it's like, we got to hurry up. We don't have enough oxygen, so we got to hurry and pump more blood to bring more oxygen instead of the blood being very oxygenated. Treatment depends on the type. So maybe if their hemoglobin is an issue, maybe it's an iron deficiency anemia, they just need to take iron. If they don't have enough red blood cells, like if their red blood cell number is low, then they need a blood transfusion. That will up their numbers. A bone marrow transplant, if it's actually a red blood cell making problem, if it's your bone marrow is not making what it needs to. Sickle cell anemia, this is a disease that people are born with. So it's a recessive trait. So in order for someone to have sickle cell, both of their parents would have had to have had it. And you can carry the trait without actually having sickle cell. One interesting thing to note about sickle cell is if you carry the sickle cell trait, you're also immune to malaria. Isn't that weird? It just works that way.
Did they like have that as a cure for, like, they gave the people with malaria that the sickle cell for a cure, and then it was like disease?
I don't know. I don't know that I would. I'd much rather have malaria, I think.
Because, like, wasn't it at a time where, like, malaria was like the major thing they killed?
Quinine is the only thing I remember they started using for malaria. But sickle cell is not like a disease that you get. This is something you're born with. So your bone marrow, what happens is your bone marrow will all of a sudden start creating all these sickled cells. So normally your red blood cell looks kind of like a donut, right? It's really slippery, it's round. There's some up there, you can't see them right now because it's dark in here, but the red kind of looks like a donut. And it just slides through capillaries really easily. But for someone with sickle cell anemia, it's like all of a sudden their bone marrow starts creating these sickled cells. You know what a sickle is? Like that old, it's like crescent-shaped knife that they used to use to like cut wheat. You know when they do it by hand? Huh? Right. But a sickle is just, the blade part. But anyway, so the cells are not shaped round like donuts. They're shaped like sickles, which makes them get clotted up in capillaries all over. very, very painful, very painful. And it causes, obviously it causes clotting problems. So occurs in people of African descent, African Americans. And the only treatment, there's no long-term treatment. It's just you treat it when they go into a crisis and you give them blood transfusion. And what that does is that dilutes the sickle cells. So you can give them regular red blood cells that are shaped like they need to be, and that brings down that ratio of regular cells to sickle cells. An embolus is a foreign substance in a blood, so it could be a blood clot. It could be part of a fatty plaque that has come off and separated. The bell's going to ring, but hang with me. We've got about 2 minutes left. Might result in a stroke or a DVT. What's a DVT? Deep vein thrombosis, right? A blood clot in the leg. A CVA is a stroke, so a blood clot in the brain or a bleed in the brain. And that can be anything, something that has moved or dislodged from one location to another. Thrombus is a blood clot, and it's stationary, right? It stays in that place. So that's the difference between a thrombosis and an embolus. There's a thrombosis, another one here. You can see where it narrowed down here, and all these fatty plaques made that really narrow, so it clotted up here. I think that's about it. This is a ventricular aneurysm. So the ventricle itself ballooned out. And here's a carotid artery surgery, cardiomegaly. Really, their heart isn't large like in the movies. And another cardiomegaly, and this one's got fluid. All this white in their lungs is fluid in the lungs. And that's it. Now make sure you study for your payday tomorrow.
Hey, what?
Payday.